Hi, good evening, everyone, and thank you for joining this webinar. I am Dr. Nandini Gokulchandran and from NeuroGen Brain and Spine Institute, which is in Mumbai, in India. And I welcome you to this webinar on recent advances in the medical management for autism and cerebral palsy. I'll be talking a little bit apart from autism and cerebral palsy on a few other neurodevelopmental conditions. Today, I'm focusing only on children. But if there are other parents or caretakers of or patients of other conditions, you can leave a comment and I will have another webinar for adults as well. So today's focus is on knowing what's new in the treatment of autism and cerebral palsy, apart from what you already know. So why are we here? Why are you here? I can see so many participants, so many have registered. So why should you spend your time coming to this webinar? Because you are either a caretaker or a parent of a child or adult with autism, cerebral palsy, or other neurodevelopmental condition, or you are a professional who is dealing with or treating children and adults with autism or cerebral palsy, and you want to know really what more can be done for these individuals or children. The current paradigm, what is currently available for autism or for cerebral palsy? Let's look at that. Number one, you have been told there is no cure. This is what you listen to as a parent. You go from one place to another and you get a diagnosis and you're told that there is no cure. Even as a caretaker or as a medical healthcare provider, if there are any, you would also tell your patients that there is no cure. There is no surgery that can be done. Means autism or cerebral palsy is not a condition, but it is a condition related to the brain, but it is not a condition where you can open up the brain and repair the brain, right? There is no surgery, like, for example, in a brain tumor or any kind of tumor, you open up the brain, remove the tumor. That's not applicable to autism or to cerebral palsy. Only thing that is available conventionally and what is being told to you is basic neurorehabilitation. You do physiotherapy, you do occupational therapy, you do speech therapy, you do cognitive rehabilitation, you do sensory integration therapy, and this is something which you keep doing day in and day out, and you're told this is all that is going to help your child. And there are no medicines to repair the brain. There are medicines to reduce the symptoms or treat the seizures or convulsions or reduce hyperactivity or treat the spasticity, but no really medicine to treat the basic problem in the brain. So no cure, no surgery, only neurorehabilitation, no medicine. This is what you have been told and you have heard day in and day out, right? So what is new that I'm going to tell you? Yes, the basic treatment or the basic cornerstone or the pillar of treatment is neurorehabilitation. We all accept that and we believe that, we understand that. But what we need to give new purpose to this for management of autism or cerebral palsy are new team members. Like, for example, you have a team which has been playing football for many years and plays in every World Cup, keeps on playing every World Cup, but somehow with all the best of intention, they're never able to reach the top two or the top three, right? So what do you need here? You need a new strategy. You need new infusion of enthusiasm, of apart from wisdom and experience, new blood here, new strategies, new techniques. And that's what this seminar or webinar is bringing to you, the possibility that along with neurorehabilitation, you have two new team members which is going to help you win the World Cup. So you have cellular therapy and you have integrative therapies. I know you must be thinking, what are these? I'm going to explain this, and through the webinar over the next 15-20 minutes, half an hour, you will learn these new concepts. Cellular therapy, also commonly known as or referred to as stem cell therapy or regenerative medicine, or this is a new advanced treatment. And integrative therapy, also known as oxygen based therapy. So these are two new members I'm going to talk more about, and a little bit about the neurorehabilitation, what is new in neurorehabilitation as well. So, why is it important to add new members to the team? For example, you have an athlete, okay? An athlete is able to run and perform and is able to win a marathon. But if the athlete has a fractured leg, you can see a fractured leg here. Do you think that he will be able to, with physiotherapy, start running again? No. His fracture first needs to be fixed. Even if he's a champion athlete, if he has a fracture, the fracture needs to be fixed, the bone needs to heal, and only then the physiotherapy and rehabilitation will help him to run a marathon again. So, if that is the case of a bone fracture, why isn't the same true for brain fracture or a brain damage? A child with cerebral palsy has severe damage to the brain. A child with autism has some areas of the brain which are working less. A child with intellectual disability also has some part of the brain which is working less. And in such children, what we are doing is pushing them. What we are doing them is doing physiotherapy and occupational therapy. And no wonder these children rebel. They don't like it because they don't understand what is happening with them, because the brain is unable to comply, the brain is unable to react or respond to the therapy or training that you're giving, because the brain is weak. So here is a brain scan, which you can see here where my cursor is pointing, that this is the brain. When you see from the side view, the green, the yellow and red is good functioning brain, and the blue is functioning less. And on this brain, which is damaged, if you do therapy or training, it is not going to benefit, because it's like walking on a fractured leg. What will happen if you walk on a fractured leg? Your leg will worsen, your fracture will worsen, there will be swelling, there will be a lot of pain, and your body will say, I don't want to walk. That is what is happening in children with autism. There are these blue parts of the brain which are working less. We need to strengthen them. We need to heal the brain from inside, which our current treatment is unable to do. And that's what the newer treatments are going to help us with. So this is a brain of a child with autism, and this is the brain which is repaired after the cellular therapy and integrative therapy. You can see the blue part has become green. So the brain functioning is now improving. The brain is now becoming stronger from inside. And now when you do the rehabilitation, now when you do the therapy training, you see better results. You see the child learns better, responds better to your training. And in overall, there is a holistic improvement, because now you have addressed the core problem, the core pathophysiology of the damage in the brain. So the old thinking was, some people think, oh, how is it possible? We have been told the brain cannot be repaired, right? You've been told that the brain damage cannot be repaired. But that is old thinking. It is as old as thinking that man cannot go to Mars. But it's not true anymore, right? There are astronauts who have reached the brain, reached the Mars, reached the moon, and hopefully soon the Mars. And the satellites are constantly going on reaching the moon. Yes, it's not easy, but it's not impossible. So what is the old thinking? That the brain or the central nervous system, once damaged, is incapable of regeneration. This is an old thought. But with the advancement of science, with the advancement of medical science and the field of regenerative medicine, it is now possible to repair the brain with the use of cellular therapy. Cellular replacement and cellular repair is a process which helps to repair the brain, and we have been seeing this for the last 15 years. So what was the old paradigm? Only rehab. That only rehab, continue to do therapy, hopefully some result, but you know that after some point there is no improvement. So what are we proposing here? That rehabilitation along with cellular therapy, along with integrative therapy, oxygen based therapy, can help reverse autism and cerebral palsy. And this is not something which we say lightly. This is something which we are seeing every day. So cellular therapy is an idea whose time has come. It is not science fiction. It is not a movie or a futuristic idea. It is something which is available now. It is something which is possible now. So when you talk about treatment of any kind, right, what do you know? Like, for example, if you have fever or if you have a tumor, you either know that you can treat this condition with medicines or with injections or medical products. That is one part. The other part is if medicine, not with medicine, there would be a surgery. You can open up the body, remove what is not required, and close it back again. That is the surgical option. So you know that treatment contains either of medicine or surgery. But what we do not know or what is new is that there is a third option, and that is of cellular therapy, which is neither a medicine nor a cut stitches nor a surgery. It is a procedure or a process known as cellular transplantation or cellular therapy or stem cell therapy. So, what are we doing here with this treatment? What have we achieved? We have achieved that children who are unable to sit or stand are able to walk now. Children who are unable to go to school are able to go to school. Children who are unable to do things for themselves are independent in their activities of daily living. Children who are unable to speak are now able to speak. So stem cell, the word comes from the stem of a tree. You can see here on the screen a stem of a tree, and the stem of a tree gives rise to branches and then leaves and flowers and fruit if you give them the proper soil and the proper fertilizer and water. So that's where the word stem comes from. Stem cells are special cells in our body. When you give proper water, they will divide and they will multiply and give rise to leaves, flowers, and fruits. So these cells, if you put them in the muscle, they can form muscle cells. If they put them in the brain, they can divide and form brain cells and integrate into the brain. If you put them in the bone, they can help repair the bone. So this is not only concerned or not only limited to brain condition. It can be applied in many different conditions or human illnesses. But today we are going to talk only about the brain conditions. So this is Stephen Hawking, a very prominent Nobel laureate, a physicist who recently passed away from.
I have spent my life exploring the mysteries of the cosmos.
Stem cells.
But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us,
which have special powers. They are called stem cells.
Isn't that exciting? So what does Stephen Hawking say? Stephen Hawking says there are galaxies of cells inside our body which have the power to regenerate. We just need to know how to harness this power. And that's what we are going to do. We have been doing this for many children and adults over the last 15 years. Harness their own power, harness the stem cells inside their body. You don't need anything from outside. The power is within you. So what do these cells do? The most important thing that they do is they multiply. So one cell can become 10, 100, thousands of cells, which is similar to its own, so clones of themselves. And depending on where they are, they will also then transform into the cell of the local population. For example, if you put them in the liver, they multiply and then they become liver cells or hepatocytes, or stimulate the liver cells to work better. That is one way. The second mechanism is they will convert, as I said, into the local cell population. Third is they release growth factors. They release brain-derived neurotrophic factors when they are in the brain, or FGF, fibroblast growth factors, depending on where they are, taking cues from the surrounding. They will release regenerative molecules which will stimulate the repair of that part. So I will keep referring to the brain because that's what we are going to talk about. So they would repair the brain cells, stimulate the brain cells to work better. And the fourth thing that they do is they form newer blood vessel. This is called neoangiogenesis, formation of new blood vessel, which leads to the release of more oxygen, release of more growth factors, positive chemicals, which will help the repair and regeneration of the brain cells. So the stem cells will help to repair, regenerate, and replace the damaged tissue. So it is like way back in 1990, if you had to calculate, you needed a calculator. If you had to do some internet surfing, you needed a PC, right? If you needed to click a picture, you needed an actual camera. If you needed to video record, you needed a video camera. If you wanted to look at direction, you needed a compass. If you had to read something, you needed the actual book. If you needed to look at time, you needed a watch or a clock. If you want to watch television, you needed a television set. But what do we have now? What we have now is a combination of all of that. We have an Android or an iPhone which can do all of these functions. Isn't that correct? So we check watch on it. Very few people wear a watch now. You can listen to music, you can click pictures, you can video record, make short films, you can calculate, you have a calendar, you can read books, you can Google search, you can do everything on your phone. That's the difference. That's what stem cells are. Stem cells have multiple potentials, they have multiple activities. Unlike a drug has only one mode of action. A stem cell has multiple ways that it works in regenerating the brain tissue. So the current age cell phone is similar to the stem cells which we use from our body. So this is a very promising therapeutic modality, very promising tool to stimulate the repair of the damage and replace the damaged cells and convert them into healthy cells. So here you can see the brain which is damaged, the blue part is damaged, and the cells go and stimulate and repair, and they replace or stimulate the brain cells. So now there are two types of transplantation. So we have the cells, we will know the source soon, but we have these cells. These cells can be taken from our own body and put back into our own body. Just like a cardiac bypass, we take an artery or a vein from our own body and put it into the heart. That is known as autologous transplantation. Auto, self, logo, body, it's putting it back into our body. The other option is taking from somebody else and putting it into the patient's body. That is known as allogenic transplantation. But for different kind of conditions, different type of transplantations can be used. So where do these cells come from? The cells, initially, one of the earliest research was on embryonic stem cells. Embryonic stem cells are taken from embryos, 3 to 4 days embryos, from in vitro fertilization clinics, from test tube babies, the wasted embryos which would be otherwise put in dustbin were cultured or multiplied in the laboratory, and from there we got the embryonic stem cells. However, they have two issues. One, ethical or religious issue, where there is a worry that you are killing a life because life starts at conception. So that's why use is unethical, or there are questions about human rights violations. The second is that these cells do have the potential to form teratomas or tumors, and that's why use for treatment, medical treatment or transplantation is not allowed. The second is the cord blood. Cord blood is the blood which can be taken from the cord which connects the child to the mother. When the child is in the womb and when the child comes out, this is cut, and then the cord blood is collected and stored in very, very low temperature. So this cord blood has been used successfully for hematopoietic or blood disorders, and it is a very good source of cells. But to use for brain conditions, there are certain reservations, because one, it could be your own, but putting it into the brain, you are exposing the brain to a lot of toxic chemicals which were used to store this cord blood. Cord blood is stored in in the laboratory at minus 190 degrees centigrade in very, very cold environment, using a cryopreservative, which is very toxic at room temperature. And hence, injecting it into the brain or near the brain is very risky. So this is a very good method for intravenous injection, using the, like, basically injecting into the veins for purposes of blood disorders, for purposes of lung disorders. So for the brain, very few cells actually reach the brain, and hence not a very feasible option for brain disorders. So what do we have which we can use now without having or endangering the brain of a child? What we can use is what Stephen Hawking spoke about, the galaxies of cells in our own body. So we can use bone marrow cells. You can see the bone here. The bone, is hollow. It keeps on producing new cells. So our hip bone in the front is the most prominent bone, and a lot of bone marrow can be extracted from there using a very simple procedure, very thin needle. And these do not need to be preserved. They can be used fresh. So this bone marrow then becomes a very good source of stem cells and can be used without any ethical consideration or any scientific rejection issues. So bone marrow stem cells are very feasible options. So there are no red or no danger signs here. It's all green. So when people say that we heard that stem cell is banned or it is not allowed in the US, then you have to understand this, that we are combining all type of stem cells in one basket. We are saying here that alcohol and homemade orange juice are both drinks and hence have to be used under guidance or licensing. But does homemade orange juice need license? Does a mother need a license from the health authorities to make orange juice and give it to the child? No, right? Because this is healthy. It is nutritionally good with lot of love. However, for the alcohol, you do need licensing. There are regulations. So that's the difference between adult stem cells, which is like homemade orange juice, and embryonic stem cells, which is like alcohol. So we have to be able to distinguish these two processes, these two type of stem cells. So at NeuroGen, we choose to use bone marrow derived stem cells because we have worked, and even before we started this work, we have our research team, Dr. Alok, Sharma, and our senior team have invested a lot of years to understand which type of cells are safe and effective for treatment of neurological conditions, because our focus was neurological condition. The whole team is focused on neurology, not on liver or diabetes. So we know that adult cells used from bone marrow are safe. No tumor formation ever reported in the literature. And in the last 15 years, we have not seen any tumor formation, no rejection issues. These are the child's own cells and hence will not be rejected or will not have any reaction, easily obtainable from the patient's own body, and no ethical issues because the child, we are not killing an embryo. Easily obtainable because you don't need to cut, you don't need big needles or big tubes. We need a very small needle in the hip bone, one needle in the back. So the source of cells that we use is the bone marrow, the child's own bone marrow. And where do we inject them? We inject here, you can see the individual is lying down. This is the main vertebral column. Inside this, the spinal cord is there, and you can see lower back is where the cells are injected. So you can see this is a spine, the spinal cord, the inside part, and you can see the vertebral column here between the two bone. This needle will go in and stimulate and inject the cells here. And these cells will go with this blue part, this cerebrospinal fluid, to the brain and go all around the brain and inside the brain. and basically go to that part of the brain which is damaged or which has inflammation and which pulls the cells towards them. So, though we have to reach the brain, we are going here into the spinal fluid. So, there is no chance of damaging the brain or spinal cord, but we reach as near the brain as possible because we are not passing through the liver or through the lungs, and the cells don't get trapped. They go directly to the brain. And that's the beauty of this treatment. It is simple and it is beautiful. So, minimally invasive, it is safe. There are no long term side effects, no major side effects. The cells will home on to the injured brain and they do not go into other parts of the body like liver, heart, lungs, because we are not putting it there. So, what is the scientific basis for the cellular therapy? The scientific basis, if you look at the world literature or the world research, the first ever Nobel Prize was awarded to Dr. Thomas in 1990 for the demonstration of stem cells in the bone marrow. That is what exactly we are using. So, we are using the most studied, most understood source of stem cells, that is the bone marrow. The second Nobel Prize was awarded to Sir Martin Evans in 2007. That is the isolation of embryonic stem cell from mice. The third is for the demonstration or for the concept of induced pluripotent stem cell, which is a new way of stem cell that from our own skin cells we can stimulate that cell and make it like an embryonic cell without using an embryo. So that's called induced pluripotent stem cells, and these two researchers got the award Nobel Prize in 2012. So what is the scientific basis of the work that we do at NeuroGen? At NeuroGen, we have almost 10700 plus international publications on various conditions that we treat, stem cell for autism, for cerebral palsy, for intellectual disability, for muscular dystrophy, spinal cord injury, brain stroke, all of these. And whatever we have studied, we have published there for the scientific community as well as for the parents who are interested in looking at what is the scientific data. It's very important for parents to understand and learn and know what is the scientific background for a particular treatment. And this is what we have put forth. It is available freely on our website, all these publications. Please do go through it. Whatever are our results, whatever are the side effects, whatever are the possibilities, everything is put there. We have also been invited to write book chapters on special books on autism. You can see recent advances on autism, on cerebral palsy, on muscular dystrophy, and we have invited to write our experience, our know-how, our expertise in stem cell therapy in various different conditions like autism, cerebral palsy, as well as a book on physical disability, what can be done, therapeutic implication for pediatric neurological condition, for muscular dystrophy. And this is our professor presenting the book that we have written to the Honorable Prime Minister of India, who is very interested in this science. He has spoken in the parliament about it, and he is interested in getting it to India. He went in 2014, he visited Professor Yamanaka's lab in Japan to go and understand the concept of induced pluripotent stem cells and bring it to India, which he did. And it is being researched since. He's written a book chapter, a message in our book on muscular dystrophy in his local language, in the language of the state, that is Gujarat.
मैं जापान गया
talking in the parliament.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So we can see the political will, the political support for this field in India. So how is the treatment done? Parents worry about whether it's a major invasive procedure. So I can assure you that this is a simple procedure. Yes, it requires needle and it requires us to go into the spinal fluid to get the best possible outcome. But it is very simple because it's done by experts. And these are simple steps brought together to form a very refined and very evolved treatment using the stem cells. So what we are doing is we are taking the bone marrow from the hip bone. You can see the hip bone here. We are taking it in from the front of the hip bone. The needle goes in here. Bone marrow, you can see, is being aspirated. The cells are separated. Cells are separated and injected in the lower back. And the cells will go from here and reach the brain. So you can see that the cells is injected away from the brain, but near the brain. And it is not injected into the IV or any other place, and so that it doesn't get trapped in the lungs or the liver. So the cells will go into the brain and stimulate the brain functioning. So this is how it is happening. I'm sorry, the video is not playing. The bone marrow aspirated. The bone marrow undergoes centrifugation. Bone marrow is like thick red blood, and then it settles. The red blood cells settle down, and you get the white cells. Here you can see I've separated it, and millions of cells in this small part. Because the cells are very tiny. You get millions of cells. They are counted in the laboratory, checked, and then injected using a very thin needle in the lower back. You can see the needles are very thin. But that was a part on cellular therapy. Now I talked to you about another team member, and that is known as integrative therapy. So integrative therapy basically are therapies which are oxygen based, because oxygen is a molecule which is important for repair and healing. And when this combines with the cellular therapy and rehabilitation, you get synergistic effect. You get effects which can combine. So one part was the cellular therapy or stem cell therapy. The second part is oxygen-based therapy. So let me explain a little bit about oxygen-based therapy, because when I talk about that, parents want to know what does it really mean. Okay, so the first is the hyperbaric oxygen therapy. So what is hyperbaric oxygen therapy? You can see this is a chamber which is transparent, and in this chamber you open it and you go and sleep here. Okay, and then oxygen, 100% oxygen is then delivered into this chamber, and slowly the pressure in the chamber is increased. Right now, you and me, we are breathing 20% oxygen from the air, right? When we breathe 20% oxygen, some part of it goes into the lungs and gets delivered into the bloodstream. The part in the expiration, the CO2 comes out. Now, this is all at normal atmospheric pressure, that is 1. So at 1 pressure, you're breathing 20% oxygen, and this oxygen is then going into the red blood cells. So here you can see the blood vessel, and here you can see the red blood cell. I hope you know what a red blood cell is, where the hemoglobin is there. And you can see here the oxygen gas is inside the red blood cells. You can't see any oxygen outside. This is at normal pressure. But as the pressure increases, you will see that oxygen now diffuses into the liquid medium, that is the plasma. So apart from in the red cells, you can see this in the liquid medium of the plasma. So you get more oxygen. And when you get more oxygen in the liquid medium, now imagine that even where cells will not able to reach, this liquid will reach, and it will improve the oxygenation of our skin, of our brain, of our liver, of our bone, everywhere, our hair roots, everything. And when oxygenation increases, then the body and the brain repair more easily. So what is happening? That the whole brain, you can see, is flooded with oxygen. Here you can see oxygen only in the red part of this diagram, that is into the blood vessel. But in the second part, where the pressure is hyperbaric, the brain is saturated by oxygen and it can reach even those places where the blood supply is blocked or damaged. So oxygen diffuses into the brain and thereby it stimulates the brain cells. It stimulates the stem cells which have been injected in the brain. They help these cells remain alive for a longer time so that they can work for longer time. So we used to do only cellular therapy and rehabilitation about 3 years back. And then we looked at what more can we add, and we added hyperbaric oxygen and ozone therapy after doing a lot of research, and we find this combination works beautifully. So this what does it actually do? You can see this cross here. This is the DNA in our body, and you can see the end of the chromosome or DNA. You can see the red part. This is the telomere. As the body or the cells become old, this red part keeps on shrinking. At one point, the red part is not there at all, and the cell will die. So the telomere indicates what is your biological age, how old are you, how long are your cells going to be alive. Hyperbaric oxygen actually helps to delay this process of cell damage or cell death. Inadvertently, in the stem cells also get stimulated. The stem cells we have put inside are able to lead a longer life or live longer to be able to repair better. Okay, so this is a video or picture of a girl going inside the hyperbaric chamber with the father, and they're very happy because they get to see the screen and they get to see TV, which otherwise they are not allowed. So we have seen that autism, Downs, intellectual disability, traumatic brain injury, stroke, the hyperbaric oxygen helps by improving oxygen in the brain. It improves the metabolic activity of the brain. It also stimulates the nerves and muscles. Multiple sessions, when taken, also helps to produce its own stem cells at faster rate and helps the healing and repair. When we say multiple sessions, we mean that at least 10 sessions along with cellular therapy. On their own, 40 sessions have to be done. But when you combine with cellular therapy, minimum of 10 sessions is enough to see the changes in the individual or child. So which are the conditions that when you cannot do hyperbaric oxygen? Few conditions related to the condition that we treat, neurological condition. We can treat it for all sort of neurological conditions. We have to ensure that the patient doesn't have a gangrene of the food, doesn't have any gas embolism, doesn't have bone infection, any infection in the body, and also ear issues like ear pain, ear infection, ear congestion. First, that needs to be treated before oxygen therapy or hyperbaric oxygen therapy can be given. There should not be any heavy metal on our body, and patient should not have very bad lungs or should not have oxygen support. So this is the video of how the HBOT is done. This is for one session, like that one session every day for 10 days. That's why we suggest a 2-week treatment, where the first 3 days is about cellular therapy and the next 10 days is about oxygen-based therapy. So the individual is going inside and he's been given a earthing that is just for safeguarding, and then the door is closed, and then the pressure is slowly increased. When the pressure reaches the desired pressure, it will be there for 30 to 40 minutes, and then once you stop the machine, the pressure comes to normal, and only then you can open the door. You can't open the door midway. That's why we do not use hyperbaric oxygen therapy for children who have regular seizures. Because if a seizure happens inside the chamber, then it takes at least 7 minutes to get the patient out. So that was about hyperbaric oxygen therapy. Now I'm going to talk about ozone therapy, which is another way of improving oxygenation. So both the hyperbaric oxygen therapy and ozone therapy complement each other. They have different ways that they are working, but the final destination is the same. In ozone, we have 2 molecules of oxygen converted to 3 molecules. You can see here, this is 2, which has a strong bond, right? 2 sticks in between. This is the third, where it has now attached and it has become an unstable molecule, but highly effective, highly skilled molecule. Unstable because it cannot remain in this form for a long time. The oxygen, where there is only one bond, will get repelled, will get pushed out from itself, and it will go and do its own thing. So this is activated oxygen, and activated oxygen with the oxygen coming out and doing its own thing will do something very good. It will help to kill the virus, the bacteria and fungus in the gut. Lot of children have lot of gut issues. They have lot of problem with eating, sleeping. They have very tandem behavior. Lot of stress in their body. Cleansing the gut, first checking how much of the problem is there from the gut microbiome and then doing the gut cleansing will give us a better way to streamline or make plans for the patient. Okay. So ozone therapy kills bacteria, viruses, and fungus. It acts as a germicidal. It reduces inflammation and swelling in the gut. It helps to cleanse the gut, so it's a very good gut cleansing medium. It reduces clots in the body. It sort of liquefies the blood. So when the blood is liquefied, more oxygen goes to different parts of our body, acts as an antioxidant. So ozone has its own way of working. Hyperbaric oxygen therapy has its own way of working. But both together, along with cellular therapy, they work together and give very promising results. So what we do is 10 sessions of hyperbaric oxygen minimum, along with cellular therapy, 10 sessions of ozone therapy, either rectal ozone given as an enema or into the ear. If there are no seizures or EEG is normal, then we can give through ear, which I will show you. There are different ways of giving ozone. Here you can see that ozone sauna. You can see that in sauna, it's like a steam sauna. You are inside and your head is out and your body is flushed with ozone. That is one way. Here you can see the ozonator. What does ozonator do? Here the oxygen is going in and through this tube, the O2 converted to O3 is coming out. So it improves oxygenation in the body, improves gut health, is a potent anticoagulant. We have also used it in COVID. It has many, many beneficial health effects, not only for neurological conditions, but a whole lot of other ailments as well. It can be given in children through rectal insufflation, that is like an enema, and through ear, through the nose, and in adults in other ways also can be given. This is ear insufflation. You can see through the stethoscope. You can see here the BOTO. BOTO means through oil. Ozone is passed through oil and then you breathe the modified ozone through oil. Ozone sauna, ozone given intravenously in COVID. And it has many, many effects as has been seen by many publications. But it cannot be given in certain conditions, cannot be given in G6PD deficiency. This is an enzyme which is important for metabolizing or using the ozone. And if there is a deficiency, then it can cause some toxicity, and hence we check routinely for G6PD deficiency. If you have acute bleeding or are in menstrual cycle, then it cannot be given. If you are having hyperthyroidism, it is contraindicated. If you have ear pain or ear pus discharge, then ear ozone cannot be given, but rectal can be given. For if there is seizure or EEG is abnormal, then ear ozone cannot be given, only rectal. This is the way ear ozone. This is oxygen. Oxygen goes through and ozone is now coming. It's a gas coming through this, and if the stethoscope, then get it in the ear. Ear ozone goes directly to the brain. Colon cleansing is more for adults. Hydrocolon therapy is more for adults, but the gut can be cleaned completely and it helps to improve the brain functioning and absorption of nutrients. This is hydrocolon. In children, we do acupressure and acupuncture, that is deep tissue mobilization, to improve the oxygenation or blood flow in the muscles. These are different publications. So in neurodevelopmental disorder, we combine cellular therapy with 10 sessions of hyperbaric oxygen therapy, 10 sessions of ozone therapy, and 8 sessions of deep tissue mobilization. So let's look at autism and let's look at the results in autism of cellular therapy and reintegrative therapies. So we know what autism is. I do not need to. It is a neurodevelopmental conditions. It is a neurodevelopmental condition which seems to be more in boys than in girls, and can be mild, moderate, or severe. Main problem of social interaction, impaired communication, and repetitive behavior, and the numbers are increasing. It is going through the roof. 70 million people in the world. In 2020, it was 1 in 54. In 2023, it is 1 in 36. So people want to know why my child developed autism. We don't know for sure, but generally it is a combination of genetic issues, which could be 10 to 15%, and almost 70 to 75% is the environmental condition. Genetic, we see many times 3 children, 2 children, 4 children in the family having autism, and there are certain genetic factors which are known to contribute to autism or autistic trait. Environmental factors could be prenatal or antenatal causes. That is, if there is a problem when the child is in the womb, if there is lack of oxygen, the mother has vitamin deficiency, vitamin D, iron deficiency, B12 deficiency, folic acid deficiencies, the different nutritional deficiencies, or mother has some infection when the child is in the womb, or depression, or a lot of stress, or is taking medications, all these could cause the child's brain development to get delayed. Intestinal dysfunction in the mother and in the child may also aggravate the problem. Exposure to toxic chemicals and use of phones and electromagnetic radiations. So these could be the factors. But let's look at what do we understand better about autism? We understand autism better in terms of what is wrong in the brain. And that is through the scans that we do, the PET-CT scans of the brain. Cellular therapy, what is new? Cellular therapy is new for treatment of autism. Here you can see the brain functioning. You can see the brain from the side view. The green, yellow, and red part is working well. The blue part here is working less. Darker the blue, lesser the functioning. And this is what is the problem in the brain, the damage in the brain. And this we have published as a baseline study in the World Journal of Nuclear Medicine, where we see that as the child grows, in a neurotypical child, you can see that the brain functioning is increasing. But in a child with autism, the brain functioning is going down. Initially, it is high, then it is going down, and you can see the gap increases as the age increases. Hence, it's important to intervene early. Early intervention is very, very critical. The earlier you do the treatment, better the results. You can push this up towards normalcy. So this is important. The earlier you treat, the better. The best results before 5 years, the second best before puberty or before 10 years. So what is the treatment? It is not one treatment for autism. It has to be a combination of all therapies along with cellular therapy. So when you do all therapies, you do physiotherapy, you do occupational therapy, you do speech therapy, the sensory integration, is it enough? No, because we know now that only rehabilitation is not enough. It just helps to manage the symptoms, but the underlying brain damage is not repaired, and hence symptoms are managed but not completely eliminated. And hence, we need to go for something which is more concrete and helps to heal the brain. And the first ever time that we published in an international journal, in Stem Cell International, was way back in 2013, where we showed that stem cell therapy or cell therapy from patients' own bone marrow is a potential treatment for autism. And this was published in 2013, where we looked at 32 individuals and looked at different domains where there are problems. And we saw that there is improvement in social relationship, emotional responsiveness, speech, language, and communication, behavior becomes better, sensory aspect reduces, and cognition improves. And it improves to different extent. 90% improve in socialization, 78% in speech, language, and communication. Hyperactivity reduces in 70%. Attention concentration improves. Eye contact improves. emotional responsiveness and behavior pattern. The second publication or the second results were published in 2020 in the American Journal of Stem Cells, where we looked at 254 individuals where we looked at different rating scales, the autism rating scales, along with brain scans, that's a PET scan. And we found improvement, as I said, in all different areas. First of all, understanding improves, learning improves, eye contact improves, the child's ability to respond to training and therapy becomes better. Thereby, the child's communication and speech also improves. So these are the scores, improvement in scores. And what we see very important is that all mild, moderate, and severe conditions improve, but we see that best results before 5 years. So 97 to 98% of the children improve before the age of 5 years. 5 to 10% improve by 94%. 10 to 15 age above 10 years, they improve. They have a probability of improvement of 90%. So the best results are before 5 years. So both males and females improve or respond well to the cellular therapy. And if you come for treatment, or if you get the treatment within a year of the diagnosis, almost 97 to 100% is a success rate. Between 1 to 5 years, 95%, and 5 years and above, 90%. So these are all the publications, international publications that have been that are available. The evidence for cellular therapy. The first ever from India, that is from NeuroGen. Second from China. Third from Italy. Fourth and fifth from the United States. Sixth from India. Seventh from Vietnam, and so on. So there is a lot of evidence on different sources of stem cells, and that means the science. There is enough science and evidence, and it's still evolving. So these are all our publications. There are no contraindication to combine it with other treatment, but you may have to keep a little gap. Now let's look at a few case reports or some examples. This is an example of a young man who is now 19 years old. He came to us when he was 11 years old with a diagnosis of autism. He came to us first in 2015, then we did another treatment in 2017, and then in 18. So initially he had a low self-awareness, a lot of eye contact was less, there were a lot of sensory issues. He would talk to himself all the time. He had a lot of aggressive behavior, screaming and kicking, temper tantrums, limited vocabulary. And after the treatment, what we found that his understanding improved, his reading level improved within 5 months. He could initially read only 3rd grade, 4th month at the age of 11. And in 5 months, it went to 7th grade level of reading. So that's a huge jump in 5 months. So reading, he became hyperlexic. Eye contact improved. Temper tantrums reduced. He started exploring new foods. Sensory issues reduced. Earlier, he would wear only half sleeved shirts. Now he could tolerate full sleeve. He could wear sneakers instead of only Crocs. His cognition understanding improved. His language development improved. His emotional development, his activities, he became more independent in his activities. His brain scan improved. This is after in 2 years. Look at his report card. His report card, most of the subjects he's got A. With a GPA of 3.833. He came to a regular school within a year or so, from a special class to a regular class. He came out of autism in about 3 years. And now he is going to college. So this is where he has reached in about 9 to 10 years. So this is amazing results that we can see. This is mother giving you a brief about what his improvements are.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So this is one example. There are many such examples. Let's see if we can see a few. This is a child.
We went to different doctors. We went to different hospitals. And when I brought it up, they were like, oh, no. Don't worry. It's because they are boys. They are triplets. They were premature. I would be walking out and I'm like, bye. And no child is crying. No child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed. It takes a few minutes and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. Send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
money.
For what?
To buy tomato lollipop. I'm going to wear my shoes. That's right.
parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that is a tripless story, and lots has happened after that. Rick is out of the spectrum. He is almost neurotypical now. Lenny and Eric also have come a long way in terms of understanding speech, ability to do their own activities. So this is another child from Kenya who came to us when he was 13 years old, is now 18, 19 years old. He was very, very difficult, very aggressive. When he came, he would roll on the ground, he would remove his clothes, run out of the house, eat chili and salt, having no understanding, having no discrimination. So he calmed down, his understanding improved, he's much calmer, he follows commands, he's more social, he's more manageable. It's not easy, but he's more manageable, and he at least he's able to do his own activities much better. He started vocalizing, doing swimming and cycling. So definitely earlier you come, better the results. So at 13 years with severe autism, it takes time, but it is possible to improve older children also. This is another child from South Africa who came to us when he was 4 years old first, and then he came to us at 5 years. What you can see on before is 4 years and after is 5 years. So earlier there was no focus, no concentration. He would understand anything, would be running around, would not sit in one place. But you can see the difference that in a year he's more settled, he's sitting, doing activities, the vocalization is less. But his focus has improved and he's learning things more. He's more engaged in activities that you are doing. So this is in a year. And what I would want to show is what happened 2 years after the second treatment. So first treatment in 2017, second treatment in 2018. And what you're going to see is 2020 November, middle of COVID, when the mother sent me this video of the child making his own video, making his own story, and talking about it.
Once upon a time, Pete the cat was walking down the street and his brand new white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes, I love my white shoes, I love my white shoes. Oh no. Pete stepped in a large pile of strawberries. What color did it turn his shoes?
When he came to us, he was severely autistic, non-verbal. Now,
goodness, no.
He's better than his peers in reading, language, in mathematics. So this is what could be achieved if we treat the autism, make the brain functioning better earlier. So this goes on for 3 minutes. These are a few other changes that you see, that motor functions improve after the treatment. Something which happens, motor coordination, balance, assistance required is less, physical notes required are less, better concentration, better focus, fine motor activity is better. Distracted, is able to do activity with less mess. Eye contact, engaging with the therapist better. Allowing oral activities, better tolerance. Earlier would not allow, can see much more allowing, so the sensitivity has reduced. are a few examples of autism. There are many more, and there are amazing stories of children who have gone out of the spectrum doing amazing in terms of the potential coming out, savant abilities coming out. The second topic is on cerebral palsy. We know the cerebral palsy is severe damage to the brain due to lack of oxygen. Problem could be during pregnancy, during labor, or shortly after the birth. And depending on which part of the brain is damaged, you may have only one hand affected, or one side of the body affected, or lower part of the body affected, or neck down paralyzed, or even understanding and vision affected. So this is a PET scan of the brain which shows you damage. The green and yellow part is good functioning brain. The black is completely dead tissue. When there is dead tissue, then no life can be put into there. But you can see the blue areas around. These are the blue areas which can be salvaged. So far treatment was either medication for tightness, for anti-epileptics, for seizure control, surgery for tightness or deformities, orthotics, Botox injection, and rehabilitation. But none of these treatments really address the problem in the brain or damage in the brain. So after cellular therapy, this data shows what are the results. We see improvement from top to down. First is understanding, comprehension, learning. Overall, for better focus, better looking at things, oromotor, tongue movement, lip movement, chewing. So children who are not able to chew or swallow, they improve better neck control. So when neck control happens, all of this will automatically, and then neck control improves, then the trunk balance, then the use of hand, then sitting and standing and walking. So this is how the improvements we will see in cerebral palsy. The brain scan, let's see the brain scan. So you can see the damage in the brain. So you can see here, this is the brain scan before the treatment. You can see all these blue area damage before the treatment, and after the treatment, the blue has become green. So this is very, very important. The brain is getting salvaged, recover. You can see above and below, the brain is just more active, is more fresh. And now that the brain has become active, now the training therapy will help to connect or network. So cellular therapy, we get only half of the work done. You need to program it. You need to teach the brain what it needs to learn, which the brain hasn't learned so far. Again, you can see the damage here is more green. So more green means better improvement. So these are all our scientific publications. This is an example of a child who came to us when he was 7 years old from a place in India known as West Bengal. And his severity was 4. So on a scale of 1 to 5, 5 is the most severe. He was 4. So he was just a little less than most severe, where he could not sit without support. He could not stand. He could not walk. He didn't have hand-eye coordination. He had poor command following. He was homeschooled because he could not go to school. And over a period of 22 months, he was able to sit better. He was able to stand and walk with support. The child was unable to speak, started speaking in sentences. He could go to school to study. So that these are very important developments. His scores went from 4 to 3. And this is a brain scan that you can see before the treatment. A lot of blue areas, the brain was not as good. And after the treatment, you can see the whole brain is now active. This happened in 22 months. What didn't happen in 7 years happened in 2 years. So this is a child from Kenya who came to us completely wheelchair bound, and his cognition was good. He was studying in school, but he could not walk to school, or he could not do his own hand function. After the treatment, within a month, you can see these improvements as he's able to use the hand to connect the charger to the mobile with support, walk to the refrigerator, open the bottle and drink it. Use these small things make a lot of difference. And over a period of a year, you can see that he is able to walk independently. This is a child who came to us when he was 3 years old and who had ataxic cerebral palsy, who had difficulty in but a lot of movements in his body. He was unable to sit, stand, and walk independently. He could not understand, could not speak properly. So after the treatment, his understanding improved, his learning improved. He could follow commands better. He could identify letters. So understanding speech improved, then hand functions improved, ability to stand, ability to walk, better trunk control, all of that improved, and he is now able to go to school and is able to study with other children. This is again a child from Kenya who came to us when he was 7 years old. For 7 years, he did not stand. We made him stand with complete support, and then over a period of a year, he first started walking with support, and then started walking without support inside the house, and then started walking without support outside the house. So this is a development over a period of a year and a half. Child who came to us with very severe brain damage. And over a period of a year and a half, when he was not no neck control, no speech timing, not able to get up. You can see before and after improvements that you can see. Slow and steady improvements, but very important. Sitting balance, more awareness, use of hands, ability to keep his trunk more erect. Ability to hold and get up from sitting. These are very steps, but important steps. Child was completely bedridden, no improvement, trying a child from Turkey who had no neck holding, you could see before. Then after 6 months, his neck holding became better. He could sustain better. Earlier, he could barely able to sit. He could not even with support sit. Now he is able to sit with support. Though support required is less. He is able to get up on his own. Support. He is able to sustain his balance and better. Another child who had difficulty in sitting, posture, he could not keep. Now he's able to crawl faster, keep his posture better. He's walking. First he started walking, standing with support, then walking with support, and slowly he's now walking without support. His speech is improved. He's able to do fine motor activities. So holistic improvement because the whole of the brain improves. Child was barely able to sit, is now able to walk without support. Intellectual disability, again, this is a part of neurodevelopmental condition disorder where brain functioning is low and the child's cognitive abilities are very less. And again, for this medication, behavioral therapy, psychological and occupational intervention is the only treatment. Cell therapy helps to improve the brain functioning, helps to repair. And first time in the world, again, we showed that it is possible to help these individuals with autologous cell therapy. So we did this study, where there were 58 patients, 29 who received the cell therapy and 29 who did only rehabilitation. And what do we see? This is very interesting and which applies to other conditions as well. So you can see here that the blue is the intervention group. That means they got stem cell therapy. And the orange is the group which did not get stem cell therapy. So the orange indicates, you can see that 20% of the orange, 20% of people who did not get the stem cell therapy showed no improvement. And 80% showed improvement. However, out of 80, 40, almost 37 to 40% showed mild improvement and only 13% showed significant improvement. As opposed to that, those who received stem cell therapy, you can see none of them, there was nobody who did not show any improvement. 10% showed mild improvement, while 62% showed significant improvement. And this is the message here, that when you combine cellular therapy with rehabilitation, you get the quality of results and the quantity of results, or quantum is much higher. So you can see the brain functioning here. This is the brain before the treatment, lot of blue. It looks as if it's a moth-eaten or or a mice-eaten brain, and you can see after the treatment, the brain is completely activated. Thank you. This is our publication, scientific papers, and these are our scans. So there are many examples, but I will sort of wind up now so that you can have a chance to ask me questions. So this is an individual who came to us at 20 years of age, had difficulty reading, writing, mathematics, no social interaction, could not go and buy groceries at age of 20, now has completed a school, can write, do mathematical calculations, calculator, can do grocery shopping independently, he can sit in his father's shop and do basic activities, he can talk to people, he can make his own food, he can converse with friends and customers. His social quotient improved by 2 years. Again, we also treat Down syndrome, though it is a chromosomal condition. Down syndrome is trisomy 21, 3 instead of 2 chromosome 21, and there are different markers. There's a problem with the way they look. There is syndromic features. Ear, eyes are different. There is a low set ears. The neck is short, the height is short, there could be bony issues, there can be heart problem, there can be a hernia issue, the tone of the muscles is very lax. But cellular therapy does not address all these problems. What it helps is the brain functioning, the learning difficulties, developmental issues, as well as their speech. So that is what the cell therapy will do. And you can see before and after, we can see the PET scan, the blue areas here are now green. So we have published for Down syndrome, we have published case reports. Now, in terms of the side effects of this cellular therapy and hyperbaric oxygen therapy, no major adverse events or complications, no neurological deterioration. But there is a 3 to 6% chance of patients developing seizures if they already have a history of seizure, even one history of seizure, or if EEG is abnormal, there is a possibility that the cells may trigger a seizure within 6 months after the treatment. So we have to give them medications. We start them on anti-epileptic medication and help to get the possibility to less than 2%. There is a possibility of a spinal headache, or a pain, nausea, vomiting within 2 to 3 days of the treatment. That's all this happens while the patient is in the hospital. No major irreversible side effects is being seen. So this is NeuroGen Brain and Spine Institute. You are most welcome to come and visit us. We treat our patients like our own family. We have treated over 13,000 patients from 75 different countries. This is our, all the treatments are within the building, within one facility. We have it's 11-storied building near a beautiful lake. And this is our operation theater, and just next to the operation theater is a stem cell laboratory. Everything goes from the operation theater directly to the laboratory through a pass box, so nothing goes out of the building, and it's very sacred and secure. And we have comprehensive rehabilitation under one roof. We believe that cellular therapy with neurorehabilitation and integrated therapy work as a team and complement each other. So it's a teamwork of therapists and doctors who work together to achieve a common goal. This is a physiotherapy center. We believe in hands-on therapy, occupational therapy. This is our Autism Child Development Center, where it's been male child friendly. This is aquatic therapy. So aquatic therapy is a new treatment that has been introduced both for autism and other neurodevelopmental as well as adult with neurological condition. Children love water. They love to do therapy in water, and that helps to improve their focus. So you can see this is an individual with cerebral ataxia, and she's doing therapy in water. This is a spinal cord injury walking track. This is more specific for spinal cord injury patients and adult patients. Sensory integration, again specific for autism and children with sensory issues. activities of daily living, very important, speech and art-based therapy. We have our Allied KLS Wellness Institute also, which is the extension of NeuroGen, where we do all integrative therapies and rehabilitation, both for children and for adults. These are all the books that are available online for both for parents and for professionals. And this is our core team, and we are accredited by GLP and GMP certified laboratory as well as ISO. And these are our awards, both European and international awards, as well as national awards for disability, work in disability. So we are reachable on this email ID, neurogenbsi.com, and this is our phone number. You can reach us by email or by drop a message. You will be appointed a specific coordinator who becomes your point of contact for everything and who will assist you for whole process. We have two programs, a 1-week program and a 2-week program. In the 1-week program, we do the first week process is similar in both, that there's an arrival on a Sunday. Monday is about evaluation and tests and brain scan. Tuesday is the actual cellular therapy, and Wednesday to Saturday rehabilitation. In this 1-week treatment, integrative therapy such as oxygen therapy, HBOD or ozone is not provided. The 2-week program will have again the evaluations and cellular therapy, and from Wednesday onwards, along with rehabilitation, oxygen-based therapies will start 1 session every day. So at least 10 sessions are important to have to give a combination effect. Only 1 or 2 or 3 sessions of oxygen therapy is not enough, and hence a 2-week program. So all those who do not have seizures, continuous active seizures, do not have ear problem, do not have breathing issues, are recommended to take the 2-week program because the combination works beautifully. So there are a lot of centers in the world who are doing cellular therapy. So what is different about NeuroGen? What is different about NeuroGen is the science behind our treatment, the research that we do. It's very, very important. All that we have researched is published in international peer-reviewed journal. I don't think anybody in the world has this number of publications, 107, for all the work that we are doing. We have written book chapters in international books. We write a lot of book materials for educational purposes, both for parents, caretakers, as well as medical professionals. NeuroGen treats exclusively neurological conditions. There are centers in the world who do cellular therapy, but they do for all different conditions. Our focus is only on neurological condition, and our team is neuro-focused. We use very safe autologous cells where there are no rejection issue, no tumor formation, and we inject into the spinal fluid so that the cells reaches the brain directly. We do a combination of cell therapy and comprehensive rehabilitation along with oxygen-based therapy. We believe the synergy works beautifully as a team. We have an experience of 15 years having treated more than 13,000 patients from various different countries in the world. And we have a team of senior professionals who are together for the last 15 years, monitoring and supervising all that is happening here. We keep researching on what new, what better, and what are the causes of the conditions and how we can help. And all the work that we do is monitored by a government-approved institutional ethics committee. So that's how we are different from others. We use adult cell therapy, and we find that it is safe and effective for neurodevelopmental conditions, pediatric, as well as adult conditions.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
This very, very inspiring speech by President Obama serves two purposes. One, that it ends on a very positive note, and the note which basically brings forth our mission of NeuroGen in helping those who have neurological conditions, help treat them and lead a more good quality life. Apart from that, it also answers the question of many people where people believe that stem cell therapy or stem cells were banned in the US. But in 2008, this particular landmark speech actually by President Obama, where he says that he lifts the ban on federal funding for embryonic stem cell research. So way back in 2008 itself, the ban was lifted, and so people know that there was a ban, but they don't know that it was lifted. So that this particular video gives us that information. So thank you for patient listening. I hope this webinar was informative, it was helpful, and it gives you a ray of hope, a possibility that cellular therapy can help you, can help your child, and can help your near and dear ones. I'm happy to answer questions now. Please put the questions in question and answer section or chat box. And so there are a few questions which I will start reading and answering. Mercy here is asking, are there occasions when a cell therapy procedure fails to have an impact on the patient? My grandson went through a second therapy, got in a situation, cared for 48 hours at the clinic, and he seemed to retrogress other than improve. The therapy was done in a period when clinic was being said to be closing. So the clinic or our institute has not closed. It was closed only for a week, and it is very much functioning. Mercy, please do connect with us offline so that we can understand what has happened. The therapy doesn't work for everyone. Yes, out of 100, I would say 90 do benefit and 10 may not. But why your child cried and what happened, there could be environmental reasons for it. We need to understand it so that we can help you. So if you could send us a message, put your child's name in the in our message box, and we will get back to you. You say, listening to a doctor, I feel like grandson at age 3 may not have matured, so hence for success you should have. No, in fact, 3 years is a very good age. Earlier we treat, better the results. We do not need mature cells. We need immature cells, and younger children do have immature cells. So if he's come for the second treatment, I'm assuming he had some improvement after the first. So we will try and understand what happened after the second treatment. Edwin is a SLP from Nairobi. His question is, what level of lumbar spine do you inject the stem cell, and how do you deal with intracranial pressure expected to raise? Now, the level of where we inject is between L4, L5 or L3, L4. Because we are injecting very, very small amount, we take out CSF equal to what we are going to inject. So we take about 2 to 3 ml of CSF and inject about 2 ml, diluting the cells in the CSF and inject back. So we don't expect the intracranial pressure to rise. In fact, sometimes the intracranial pressure drops a little bit, leading to a spinal headache. So I hope, Edwin, this answered your question. And Mercy, please do get in touch with us offline and send your child's name if you're comfortable here or offline. And we'll try to understand what happened with your son, with your grandson. Please feel free to send me more questions. So if after the treatment there is any so-called side effect or regression that you see, please do feel free to reach us. We are happy to support you from here to try and understand what the problem is. But usually in younger children, we get beautiful results. Very, very unlikely that the cell therapy has caused the regression. In fact, it could happen more in children who are 13, 14, 15 years, who are in the hormonal phase, where there is puberty setting in. That's the time when it becomes, sometimes it is a little difficult, because the brain is, it's difficult for the brain to adapt. There are a lot of hormonal surges which causes a lot of aggressiveness in the child. So those are the situations where we are more cautious, and we do guide you or counsel you. But Mercy, in your grandson's case, I would like to analyze more what is happening. I'm not seeing any more questions. Here, does a child donor needs to match, and how do one get a perfect match? No, Sunita, we do not use, at NeuroGen, we do not use donor cells. We use the child's own bone marrow, and hence no matching is required. Here in Africa, we might not afford to come to India. Is there a chance that your services to be decentralized? We are trying. It's not easy to set up a center in another countries. We have got a very positive response from the Deputy Health Minister of Tanzania during one of the conferences we attended last weekend. But there are a lot of people do traveling to India, not only for stem cell therapy, but for other medical treatments as well. So a little effort from your side could help. People come for bone marrow transplantation, people come for brain surgeries, all kinds of surgeries, in fact, for blood disorders. So it may not be as difficult as you think it is. Abu Bakr, thank you so much for acknowledging, and I hope it helped to spread the good news that it is possible to treat children with autism, cerebral palsy, and other brain conditions. Sunita, the cost. Today's webinar is about the medical part of it. For the logistics, one of my colleagues will get in touch with you in the next couple of days. You will, and you could, they will first understand what condition you are looking at, what is the child's condition, and help you with the cost as well. So thank you for attending. So I'll be waiting for a few more questions. If there are any questions, queries, you can send it on the, you will get a recording of this webinar, and we will get in touch with you, and you can then connect with us one-on-one. Some of my colleagues will get in touch with you to understand more about your patient, and if you have any more queries, and we will connect again for a virtual OPD after this. Is there a question here? Thank you for your time and response. We wait for further. Yes, Sunita, we will get in touch with you. Thank you so much. And there is one more. Thank you for contacting my TV. Sandra, most welcome. And thank you for acknowledging. Thank you for the feedback as well. Do send your feedback. If you want any more subjects or any more topics to be spoken about, please do put in a message to us. Take care and have a great weekend. And I'm signing off now. See you all.